Welcome to the Body Shop Physical Therapy. My name is Catherine Price and I'm a physical therapist. Today I'm going to go over the Egoscue method for chronic wrist and hand pain. Before I begin, I'm going to speak a word of life from Psalms 97:10-12. Let those who love the Lord hate evil, for he guards the lives of his faithful ones and delivers them from the hand of the wicked. Light shines on the righteous and joy on the upright in heart. Rejoice in the Lord, you who are righteous, and praise his holy name. Amen. So this is the menu for hand and wrist for those who have chronic hand or wrist pain. So people can have chronic tendonitis in the wrist or hand pain, carpal tunnel syndrome. There are 9 muscles that affect the thumb. A lot of folks that do hand work can have irritation and pain in the thumb region, and that's going to be the hypothenar eminence. And then folks can have problems with their tendons. The fingers actually do not have any muscles in them, but they have tendons that function on a pulley system and glide. And this is going to be a menu of postural exercises to help align the body in order to reduce and diminish chronic wrist and hand pain. So what I'm going to use is a chair. So I have a chair, a timer, and then I am going to use a block. You can use a pillow. And these are going to be the exercises. Let's start with shoulder shrugs. So what I'm going to do, you want to stand up against the wall, and I'm going to relax my arms down by my side, but I want my hips to be against the wall and my upper back against the wall. I'm going to squeeze my shoulder blades together. So when I squeeze the shoulder blades together, I am going to bring my shoulder blades against the wall. Then I'm going to take my shoulders and I'm going to shrug them up and then back down. And what I should feel is the shoulder blade gliding against the wall. So I'm squeezing my shoulder blades together, and then I'm going to glide up and down, and I'm going to do 2 sets of 10. So these are the shoulder shrugs. So 1, down, 2, down, 3, down, 4, down, 5, down, 6, down, 7, down, 8, down, 9, down, and 10. And then I'm going to relax. Now you should feel the shoulder blade gliding, and you should hear that shoulder blade rubbing against the wall as you are going up and down. One more set. So hips are against the wall, upper back's against the wall, and my heels are against the wall as well. And hip width apart, legs, good alignment. I'm going to squeeze my shoulder blades together. So I'm squeezing them together, then I'm lifting them up and then bringing them back down. 2, back down, 3, back down, 4, back down, 5, down, 6, down, 7, down, 8, 9, and 10. And then relax. So that is the shoulder shrug. Then I'm going to do shoulder rolls. So what I want to do is I'm going to stand with my toes facing forward, hip width apart, and keeping my hips square. I'm going to then bring my shoulders up, back, and down to make a circle. Picturing a clock on this side, I want to do 10 rolls back and then 10 rolls forward. I'm going to do 2 sets of 10 each direction. So I'm going backwards, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then I'm going to go the opposite direction. I'm going to bring my shoulders back, up, and around, forward. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and reversing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and last time going forward. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. So those are these shoulder rolls. Then I'm going to do standing wall with block. So I'm going to grab my block and I'm going to need a timer. This is going to be anywhere from 6 to 8 minutes. I'm going to set my timer for 6 minutes. And what I'm going to do is put my heels against the wall. I'm going to place the block between my knees, and I'm just going to have enough pressure to hold that block in position. And I want to keep my hips and my upper back against the wall and my arms relaxed down to my side. I want to keep my abdominals relaxed, so I am just going to rest my abdominals, keeping my upper back. You're not trying to press your head into the wall, but the head will eventually relax back closer to the wall as you settle into the position, and the hips and the heels stay against the wall. I want to tighten my thighs and keep my knees straight. So what I'm doing is I am positioning all of the load joints, and this is going to allow the body to align and keep balanced stress on the loaded joints in the body. So as I'm standing here, 6 minutes is a long time, and while I am holding this position, I'm going to then take my focus on my breathing, and I'm going to take nice diaphragmatic breaths. So I'm going to breathe in from the bottom of my rib cage, and then exhale, just allowing the breath to fall out. So as I breathe in, I'm going to feel my ribs press against the wall, and my rib cage, lower rib cage, is going to expand outwards. So I'm taking a breath in and out. And I want to keep my upper back and my hips against the wall, and then cue in to tighten the thighs. Make sure the thighs are staying tight. It's easy to let those go. It takes focus to hold this position for this long. So just taking breaths in, all the way out. Breathing in and out. And breathing in from the lower part of the ribs. And breathing out. Keep those thighs tight. This is also a good time to check in with your breath. A lot of folks, when you take a breath in, we're used to breathing shallow, and we use these neck muscles, the accessory inhalation muscles, to pull the air in rather than the diaphragm. So check in with your shoulders that you're not bringing them up to your ears when you're pulling the air in, and trying to pull the air in from that diaphragm muscle, the muscle at the bottom of the rib cage. And exhaling. Taking a breath in, all the way out. Breathing in, all the way out. Checking in with your legs to make sure your thighs are tight, your hips are against the wall, upper back is against the wall, abdominals are relaxed. Again, I feel my legs let go, so I have to check in and make sure I'm keeping my thighs tight. heel's against the wall, upper back is against the wall, and keep holding. I'm going to breathe in for a count of 4. I'm going to hold, and then exhale. Breathing in, hold, and exhale. Back to diaphragmatic breath, taking a breath in, all the way out. Keep the thighs tight. All the way out. Breath in and out. And we should be getting close. Let's check our timer. 20 seconds. 20 seconds, 20 seconds. So just, and again, if you feel that you will benefit for a longer hold, you can hold this position for 2 more minutes, 8 minutes. The time for holding is important, so 6 minutes is the lower count to hold. 3, 2, 1. All right. Then what I'm going to do is a standing quad stretch. And so I'm going to grab my chair, and what I'm going to do is you're going to use something that's comfortable to place your foot. You're going to keep a pointed foot when you do this. I'm going to go back to my timer and set my time for a minute. We're going to do 1 minute holds on this one. So standing quad stretch. What I'm going to do, I'm going to stretch my right quad first. I'm just going to use the wall for balance. So you want to be somewhere where you can balance yourself. You can use the edge of your couch or something comfortable to prop your foot up on. So what I'm going to do is take my leg, I'm going to bend my knee, my toe's going to be pointed, and I'm going to rest it behind me with my knee pointing straight down on the leg that's stretching, and I want to keep an upright posture. So what I'm going to do is I'm going to use the chair to put my foot resting right here. My knee is going straight down towards the floor. I want to stand tall and relax my arms, so I can use the wall for balance, but I'm going to keep my arms relaxed. The standing leg is going to be the straight leg. You want to take your thigh and you want to tighten that leg, and you want to hold a tight thigh on the standing leg, and then you want to, the knee on the bench where you're stretching the quad, you want that knee to point straight down, and then you can take your pelvis and you can tilt it slightly backwards to get more of a stretch through the front of the leg. Now the higher the foot, the more stretch you're going to get in that quad. So you can place that leg up as far as you can get a good stretch, but maintain proper alignment. 18 seconds, 16, 15, 14, and just hold this position. Remember to tighten the thigh on the standing leg. 4, 3, 2, 1. Okay. So then I'm going to do the same thing for the other leg. I'm just going to set my timer again for 1 minute. I'm going to take my left leg now, rest my foot right on the chair. My standing leg, my straight leg, I'm going to tighten my thigh. And then I want my knee on my left side, where I'm stretching the quad, to be pointing straight down. So I'm going to tighten the thigh on the right side, and I'm going to point my knee straight towards the floor. And then I can take my hips and tilt them slightly backwards to intensify that stretch on the quad on the left side, or the side that I'm stretching. And I'm just using the wall for balance and holding here and tightening that thigh on the standing leg, relaxing the neck and head, just letting everything be in proper alignment. You got 20 seconds left. and you want to keep the foot pointed on the side that you're stretching. Quad. And that is a minute. So 1 minute for the standing quad stretch. Next, I'm going to do hanging. So I'm going to have my feet hip width apart, toes are facing forward. I want to tighten my thighs, and then I am just going to forward fold down, and I just want to keep my thighs tight, relax my head and neck down, and I'm going to hold this for 1 minute. And I want to make sure that I'm keeping my thighs tight. Tighten those thighs and relax your head and neck. You don't want to stick your butt in the air. You're trying to keep your thighs tight. You're just going to hang forward. This stretches the back, superficial back line of the body. And just holding here. 30 seconds, keeping the thighs tight on the front. Keeping my thighs tight. I've got 15 seconds to go. 5, 4, 3, 2, 1. And that is a minute. So that is hanging. Then I am going to do a wall clock. So you're going to find a place up against the wall. And what I want to do, this is going to be 1 minute holds. And I am going to go ahead and set my timer. And I want to turn my toes in so they're pigeon-toed. I want to take my thumbs and I'm going to point them away from the wall, and I'm going to use a golfer's grip. So that is where I'm going to curl my fingertips. I'm going to keep my first knuckle straight, and I'm going to keep my thumb extended out, and I'm going to hold my my thumbs towards away from the wall, using my shoulders to rotate the arms. And I'm just keeping my body up against the wall. My toes are turned inwards in that pigeon-toed position. And I'm just holding this. You want to keep the fingers flexed, that first knuckle extended, and hold this position. About more than halfway there. And that should be getting close to a minute. So the position of the hand is important. You want to use a golfer's grip. So what I'm going to do when I've got my hands up, my thumb is extended and my fingers are curled in, my first knuckle is straight. So that's the golfer's grip, and that's how I want to hold my hand. I'm then going to, after 12 o'clock, so these are clocks, then I'm going to keep my pigeon-toe position against the wall, and I want to go to 10 and 2 o'clock and hold this for a minute. may feel some fatigue in the hands holding this position. About 10 seconds left. And the last position is going to be at 3 and 9 o'clock. So one more position. All right. So I'm going to make my golfer's grip, get that pigeon toe position against the wall. I'm really rotating my thumbs away from the wall using my shoulders. And then I am going to hold this position for 1 minute. We've got 40 seconds to go. And you want to keep that golfer's grip. There can be fatigue in the hand and the muscles as you are holding these positions. Keeping that thumb extended. This is not easy. So thumb is pointing out, shoulders are rotating that thumb away from the wall. 20 seconds. 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And relax. So that's wall clock. The last one is going to be a wall sit or an air bench. And so I want to find a place against the wall. And I'm going to do this anywhere from 1 to 3 minutes. You want the feet to be hip width apart. You want to drop down to as close to 90 degrees as you can in that chair position. And you want to hold for, so I'll tell you when it's 1 minute. I'm going to set the timer for 3 minutes. You want to try to build up to holding this for 3 minutes. Your hips are going to be against the wall. Your upper back is against the wall. And you're just going to hold this position. So if you're having knee pain, you want to push up and come out of this position to where that knee pain diminishes and you are not experiencing that. And if it is too much, then you want to avoid this. So this you do not want to do if you're having knee pain, but you can raise up and keep that knee from hurting. So you are going to feel the thighs working, the top of the legs, and you just want to hold this position. As you're in here, you can also work on your diaphragmatic breathing, so just taking nice breaths and allowing the ribs to press against the wall as you're inhaling with the bottom of the rib cage so that the shoulders are not going up into the ears. Okay, you're at 1 minute, so you can come out of this. That is going to be a minute. You can stay anywhere from 1 to 3 minutes, and I'll tell you when you've gotten to 2 minutes. And just hold this position. It's not easy. I'm going to do some box breathing, so I'm going to take a breath in for count of 4, hold for 4, and then exhale. So breathing in. Hold and exhale. Breathing in, hold and exhale. And 5, 4, 3, 2, 1. That's 2 minutes. 1 more minute to go. And just holding, keeping the hips against the wall and the upper back against the wall. The abdominals can stay relaxed. You're using your legs and your toes are facing forward. 40 seconds to go. Doing great. Taking a breath in. Twenty seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and that is 3 minutes. So that completes the Egoscue method for addressing chronic wrist and hand pain. I hope this is of help, and have a blessed day. Thank you.